Hi, we're going over the Terumo TR band after physicians go radial access and want closure. So it's almost like a wristwatch. Obviously we are demonstrating here, but there is no access site, but you presume when there's sheath still in is when you want to actually put on the device. So while the sheath is still in, you actually want to wrap the device around the wrist. The device has a green marker right there. That is your indication of where to place this device. The green marker should be proximal to the access site. So if access is here, we're gonna put the green marker right there. I hope that's clear.
Yeah.
And then obviously if you wanna go on the other side and the access is here, you gotta make sure you rotate the device. You don't just slide it. So the balloons are on one side. So again, I'll repeat that. If access is here, you put the green marker here. When access is on that side, you don't slide the device, you rotate it so that the balloons and green marker are in the correct place. After that, it's a nice comfy Velcro strap. You'll just open it. So again, we're presuming that access is here. So I'm gonna place the TR band over with both, so these are the balloons, so both around. You're gonna lift the patient's forearm and just should be snug, not like tight. The pressure is gonna come for the balloon. You just wanna make sure it doesn't move. And the green dot is the most important, and you leave it there while the access sheath is still in place. The only other component to the device is this specialized syringe. It's not lure lock, it's not slip tip. This is basically designed specifically to make a connection here. So per our IFU and the labeling, the max you want to pull the syringe to is 18 mLs, which is on there. It says on the packaging max 18. So that's where you start from. So you'll take the syringe and go to 18 cc's, and we use air only. You'll push and twist to engage, and it creates a good connection. And then you'll go all the way up and you'll see the balloon with the green marker actually goes against the skin and the balloons inflate. So obviously you start with all 18, and as you were going up in pressure, you should have removed the sheath. And then once the sheath's removed and all 18 is, then slowly titrate until you see bleeding. And once you see bleeding, go back up 1 to 2 cc's and disconnect. Mark how much air was put into the device. So we started at 18. What's left looks like 5. So that means 13 cc's are in the balloon left. And then check for patent hemostasis. You want to feel blood flow without seeing blue fingers anywhere. So just make sure that you do see blood, or you feel the pulse, and check for blood flow. Now the patient can go to PACU, and then depending on how much heparin was used determines if it was a diagnostic or interventional procedure. 50 units of heparin is the indication or the difference between diagnostic and interventional. So 50 or less, it's diagnostic. 50 or more, it's interventional. If it's diagnostic, you can start to remove air or titrate out after 1 hour. You take 3 cc's. Interventional, it's 2 hours, and then take out 3 cc's. Unless otherwise specified, and these are per your protocols at St. John's, unless the doctor specifies differently. So let's say an hour has passed, it was diagnostic. This syringe needs to stay with you. You'll attach the syringe, keep your finger on the plunger because again, negative pressure will put the syringe back down. We'll push the syringe out too quickly. So thumb on the plunger, attach, and slowly let out 3 cc's. And then look, if there's no bleeding, disconnect and walk away from the patient. If there's bleeding, go back up 1 or 2 cc's for the bleeding to stop, and then give it another 15 minutes before coming back. That's the device. After that, once you take the first 3 cc's out and there's no bleeding, it's 3 cc's after every 15 minutes until it's fully deflated.